Hi, good afternoon, everyone. I'm Matt Carter. I'm head of Behavioural Insight and Evaluation at the Health and Safety Executive. And I've worked in behavioural science for, I think, coming up to 4 decades now, which is too long. But across Whitehall, across local authorities and in governments overseas. However, I am very new to farming. And hence I've worked closely on Rick's depth knowledge of farming and of agricultural researchers in HSE to develop some new research that targets farmers' attitudes to health and safety. And I'm going to try to condense that very quickly into about 10, 15 slides. There are 100 detailed slides, but I'm going to save you that pain and instead try to go through sort of the findings of the research, which is an attitudinal segmentation. The objectives of what we were trying to achieve were to understand the drivers of risk-taking behaviours, including the cultural, business and demographic factors, look at the barriers to adopting less risky behaviours in terms of awareness, engagement and taking action, and look at how different farmers react to messages and how different farmers react to interventions and key how to optimise those reactions to save lives and reduce injuries and ill health. So this is the methodology. I'm sure you're not interested in it, but the key points to mention are that it was very robust. We commissioned the research to Ipsos Mori, who did the research for us. We spoke to a lot of people before engaging in the main part of the primary research, including getting farmers' views on their perceptions, their theories of what causes good attitudes and behaviours. And it was quite robust. We interviewed 1,638 farmers with 30-minute interviews on the phone conducted by Ipsos Mori, asking a huge range of questions about their experience, their knowledge, their sources of information, their communications, their behaviours, the accidents and illnesses that they suffer. That produced thousands and thousands of data entries. And we analysed that using principal component analysis and cluster analysis, which basically looked for trends in the data that farmers told us and came up with a segmentation of how farmers deal with health and safety. And it comes up from what the farmers said, not some theory that we had beforehand that we were trying to prove. And so that's the main point I want to say there. But to explain sort of what is a segmentation, we don't want to treat everyone the same. Organisations don't, because people respond to different things. They have different needs. So we develop segments to treat groups of similar people in similar ways. And that's the middle option there. Ideally, we would treat everybody differently to their specific needs and preferences. However, that's hugely complicated and unrealistic resource requirement. So segmentation is the middle ground that lots of organisations do. And segmentation is everywhere. It's often under the radar. Almost all large retail services and service providers use segmentation. In the private sector, it's to sell products. In the public sector, it's to bring about social change. So to just give one example here, HMRC has a segmentation on taxpayers, which I'm sure is all of us. And it works out whether people are willing and able and happy to pay their taxes on time, whether they need support to pay their taxes, or whether they will break the rules at every opportunity, or whether they're just unaware of what they ought to be doing. And what HMRC does, and I know this because I helped develop this segmentation, is they will target people with different communications according to the segment that they model you in. So at the end of the tax year, when you need to do your tax return, you might get a message that says, if HMRC has modelled you as need help, you need to pay your tax return, here's the helpline, here's some advice, please do this on time. But if they've modelled you as a potential rule breaker, you'll get a message that says, you need to pay your tax return by this date, we are monitoring you to make sure that you do so. And we treat people differently, and that's true, you get that. I get that. So what about farmers? And this is the top line finding of the research. This is sort of the big reveal of the research in a way. It's looking at 4 segments that farmers fit into in terms of their attitudes to health and safety. And that's what came out of the data that farmers provided. And planners, 45% of farmers were calling planners who feel most risk averse, but they feel safest and most able to manage risk. 14% were categorizing as pragmatists, risk takers 18%, and farmers who feel more unclear about health and safety than the other farmers, 23%. And this is where I'm at great risk of insulting everyone in the room, because nobody likes being put into a box. And of course, everyone exhibits some aspects of all these characteristics. It's just that the data showed there were correlations between people's knowledge, their attitudes, their behaviours, and the illnesses and injuries that people get. And that came up with these segments. The names, they're not so important. It's just to try to separate these groups. So in a little bit more detail, planners. Planners represent 45% of all farmers. And some examples of the planners' attitudes, behaviours and experience are the research shows that planners are very careful in their daily lives. Farmers who are planners have the strongest belief that accidents are avoidable. And of course, accidents are avoidable. They undertake the most proactive risk management. They feel most able to manage risk and have the fewest accidents. Not to say that planners don't have accidents, they still do. And it's not to say that their knowledge is correct. They don't always have the right knowledge, but the evidence shows that farmers with these attitudes do indeed have the least accidents. And pragmatists, 14% of farmers fall into this category. The key thing about pragmatists is that these are farmers who are least worried about their health and safety and others' health and safety. They're sort of a bit laissez-faire. They feel that they know the risks on the farm. They're the least group that's likely to change a process after a near miss. It's like, oh, I've learnt that. Leave it. But they still undertake many risky management processes. They feel safe. They're unlikely to do things that they know are risky. And they still have accidents. Here's the most interesting group, the risk takers, people who consciously take risks, farmers who consciously take risks, 18% of the population. Most likely to enjoy taking risks, but they do worry about the consequences of death and injury, and that's a clue to how we can target this group. Even though they're worried about death and injury, they still undertake behaviours they know, fully well know, to be risky. This group is most likely to consider that accidents are inevitable. Something we press just is not true. And in specific terms, these farmers are most likely to leave the tractor engines running. They're most likely to undertake tasks that they know they don't have the right skills and the right equipment to do. And very interestingly, there weren't many demographic trends or statistical significance trends with the segments, but this group did come out as older. The older farmers were more likely to be risk takers than the other categories, although age follows across all the segments. And finally, we have the segment that we've termed unclear, farmers who are least clear about health and safety. They feel least safe, they have the most accidents, and they seem unclear what to do. And this segment represents 23% of farmers in Great Britain. They comparatively think farming is always risky. They feel the least safe. They undertake the least risk management. They're least likely to have sought safety advice from other sources. And they're most likely to work when they are sick or when they're overtired. May have no choice. These farmers have experienced the most near misses by some considerable margin and the most accidents. They're more likely to be on smaller farms. One of the trends that came out quite significantly, and these farmers have the least positive well-being, possibly suffering the most pressure in their daily lives, and sometimes sort of struggling. Some of these farmers were struggling with their work on the farms. These farmers are most at risk from injuries and ill health, but it's important that we don't only focus on this segment, as all farmers are experiencing accidents. So to try to bring this data to life a little bit, this shows some of the findings on risky behaviours, and I've just cut a few of the slides together to give an overview. The middle line shows that 55% of farmers state they never do something risky to save time. But for planners, it's 72%, and only 28% of the Unclear state that they never do something risky to save time. They're doing something risky to save time most of the time, a lot of the time. This slide also shows the main sort of unprompted health problems experienced by farmers. Interestingly, lungs and breathing, farmers' lung, we know that's a problem. Wear and tear. Interestingly, younger farmers were very concerned about wear and tear, probably not experiencing the full consequences yet, but very concerned. Chemicals and solvents, and stress and mental illness. Particularly in the Unclear segment. And there's further health problems. I've just given the top level here. And you'll not be surprised to hear that animals are one of the main causes of injuries and accidents, as well as sort of manual labour and, sadly, as we heard today, machinery. And sort of where do farmers go for sources of advice? On the positive point, a lot of organisations are highly trusted by farmers in terms of sources of advice. We were pleased to see that the HSE was trusted, the NFU was trusted, and a lot of organisations were trusted, but very, very low levels of farmers seeking knowledge, asking for advice from quite a wide range of sources, but the levels were very low. And in particular, and you can see by some of the data here, that it's the Unclear farmers and also the risk takers who were seeking the least advice. And maybe there's something cyclical here. But that's something that isn't great. So another key finding of the research was we tried to look at how farmers of different segments related to messaging on health and safety. And we showed that farmers reacted quite differently according to these segments. And we described in the research 4 types of messaging. Emotive messaging, such as those sort of posters that show sort of graphic images of farmers with serious injuries, often used in HSE campaigns, actually, with agriculture. These messages, they did engage the risk takers and the pragmatists, so that's great. But it was a very clear finding that the farmers who were unclear were turned off by those messages. They put their heads in the sand. They just said they are not engaged by those messages at all. And that's really important because these types of messages have been a key source of our campaigns on health and safety. General messaging, such as messaging that highlights that health and safety is important, we found farmers said this has limited value. Don't pay much attention to these. It reinforced planners' views. And again, the Unclear segment was particularly turned off by these types of messaging. Then specific messages that focused on very specific activities, such as do this rather than this, mostly positively engaged by the groups, but ignored by the pragmatists, whose attitudes is they know this, and it's not important. And then different types of supportive messaging that is warmer and more encouraging to farmers, dismissed by some groups, but this was the type of messaging that the Unclear group was most engaged by, and this was a way into that Unclear group. So this wasn't a surprise that different groups respond to messages in a different way, but the strength of the correlation was quite strong. And it highlights the importance of knowing your audience and targeting messages to have the most impact. And that's the heart of what a segmentation does. So how can we take action on the basis of this research? I've just touched on the very top level findings. Well, HSE are looking at how we can use the segmentation. However, we can all apply the segmentation to how we communicate with other farmers, and we probably do already, actually. We all know people who broadly fit these personality types. I'm sure you can recognise yourself in these personality types: the planner, the pragmatist, the risk taker. So if we see something wrong on a farm and we want to say something, let's consider what segment, what type of person that farmer is, and consider how we can frame our messages to have the optimum impact on that farmer. So Can we use reinforcive language with planners if we think that person is very conscientious about health and safety? Can we use emotive language with pragmatists and risk takers? But if you think this farmer is unclear about health and safety, don't use the emotive language. That's what the research would say. And can we be particularly supportive with the unclear farmers? As I say, we probably naturally do this anyway. It's probably part of our psyche, but it's useful to have a framework that you can sort of apply these approaches to. And in summary, the segmentation doesn't come up with a silver bullet that says you must treat all dairy farmers like this and you must treat all farmers under 30 like this, but it does provide some understanding of why farmers behave like this, some of their attitudes and clues about how we can encourage farmers who are undertaking risky behaviours to improve those behaviours actually and those activities and reduce accident rates. However, we need to appreciate that farmers are diverse, farmers are people and people are diverse, and farmers are diverse and have different needs and respond to different stimuli. And the segmentation is a useful tool that can help us cut through this diversity to develop evidence targeting strategies. One of the points that was made at this morning's sessions, right at the end, the importance of using science to develop policy and develop actions that can resonate with groups of farmers. And I'll pass back over to Rick, who will talk about some of these implications of the research.
I'll go back to roaming around. That was a lightning whistle stop through something that I've spent the last 6 months trying to get my head around. But the reason for telling you that is it's informing what HSE are doing to help agriculture, to help farming. But we also need to look at it and say, what can you do? Because you are much more powerful than we are in terms of your reach and your voice within the industry. Essentially, it's going to tell you something you know already. You can't bang a square peg into a round hole, well, not unless you're going to damage it a lot. And that's what we're going to have to try and do, is work out how do we deal with people differently. So here's a few quick thoughts just to close out on this of what it means. The first thing that struck me when I looked at this research is, are people getting it right? So for the planners and pragmatists, these are the people that we look at and they say they are most likely to plan a job, they're most likely to think it through. We think they've got safe behaviours. But if your answer to health and safety is be careful rather than guard it, you might not be doing the right thing. So I'd look at that group and say, we've got a massive amount of information. I'm pointing to our website because I know it's there. The NFU has, the Farm Safety Partnership. There is stuff out there. If you are the sort of person that plans your work, or your neighbour is, just make sure they know they're actually planning the right thing. Because I've seen really well-planned jobs in the eyes of the planner where we look at it and think it is an absolute catastrophe. So let's make sure those that want to get it right really are getting it right. There's another group that we could think about. There we go, our risk takers. Some of the lines that we actually heard from those is, it's brilliant when you've beaten the odds. And these are the group that will actually say, I do things that I know could injure or kill me, but I can get away with it because I've done it before. Now, I would look to some of our great ambassadors. Tim, look up, you're famous. Got your picture there. And these are people that we've worked with because they've got a message, they've got a story. And you'd say to the risk takers, are you actually listening? Because we've got people here that can tell you the consequences and can tell you the impact, and is it really worth taking that risk? These arrows go both ways, by the way, because it is actually, you can recognise the risk takers and you can tell them. And then this last group, these are the ones that I think we need to focus a lot on because they report having more accidents than any other group. They're 23%. Some of them report having the same accident more than once, so they don't quite learn from it. And I would look at things like the events that HSE's been running for the last couple of decades, safety awareness days, training days, and say, go and ask. Or if you're in the position of providing this sort of help and advice and you recognise someone that doesn't quite get it, go and tell them. Why should we keep the information to ourselves? So that, to me, is the quick whistle stop of how we can apply this thinking. The other thing on my final slide is just to say help is all around. Tom, on behalf of the NFU, with Guy Smith as the chair, represents the Farm Safety Partnership, which we now refer to as England. There's a Farm Safety Partnership in Scotland, there's one in Wales, and they are working very hard. And the reach of those partnerships, the potential is phenomenal, because if you haven't heard of them or know who's in there, there are all the major stakeholders, engineers, the supply chain and so on, all of those who've got touch points with farming, all of those could carry those messages for you. There's other campaigns. I've also put at the bottom the Health and Safety Authority and Health and Safety Executive Northern Ireland, because they do something very similar. And they say to us, go to our website, help yourself, use it, do what you want with it. If it saves a life, it saves a life. You'll be familiar with the Yellow Wellies, the Farm Safety Foundation. There's another organisation. And it is about all of us working together, whether it be as farmers, whether it be as farming organisations and representatives. And that's about improving the health and safety of people. I appreciate also we need to think more broadly. All of this will apply when we start talking about the well-being, when Aaron's talking shortly. That's all I need to say. I'm going to look to the chairman as to how he wants to handle this now.